right, looks like we're live, Michelle. Welcome to Dr. Simon's Metabolics and Weight Loss Ask Me Anything Facebook Live event. It's Monday. We do these every couple of weeks. We are open today. We're always open in both offices on Monday, unless it's like Christmas or Thanksgiving or something like that. You know, Thanksgiving's on Thursday. It couldn't be on a Monday, but
we won't be closed that Monday.
Yeah, but a holiday, you know, that's what I'm saying. Yeah, like if it's July 4th, maybe. Yeah. So anyway, we're happy that you joined us. Thank you for being a part of this and for sending in questions. And some of you have, and if you want to send in any questions while we're going, I've got a producer that fields those and can get them to me, and hopefully we can get them answered before we get off the air.
And if it's not a question, if it's a comment, you just want to let us know you're watching, please go ahead and do so. We love to know when people are watching live and are interested and agree with anything or have questions.
So if it is your first time, I'm Dr. Simonds. This is Michelle Kennedy. She's a nurse practitioner in our Raleigh office, and we field questions and try to answer them in regards to a lot of different topics that in some way, shape, or form, have to do with the treatment of obesity. So let's start with Joan from Durham.
Joan is asking, do you work with children to lose weight? If so, what ages? And we do get this question a lot. We have a lot of parents whose children are struggling, and they ask us, what are the options? What's out there? And in the Triangle region of North Carolina, there are a couple of really wonderful program for younger children. Duke has a great program. I believe Wake Med has their own program specifically for younger children. In our practice, we do work with younger teenagers, typically, I would say. It's more about their mental readiness. That's what I tell folks. So when I'm asked this question by a parent, I say, it's not so much their age, it's do they want to be here? Have they asked for help? Like, do they seem ready to do things like track their food and really make changes in their life that are going to be difficult? And I think a big thing with treating children and adolescents is the family on board, because they're going to need support. They're not the ones typically doing the grocery shopping and doing the cooking. So there has to be a whole family approach, which is why it works really well when one or both of their parents already comes to our practice. So
that's right. I like a family approach. I don't like the idea of taking a teenager and throwing them into a mix of family members where they're not, where it's, hey, you need to lose weight, teenager. The rest of us are going to stand here and eat the wrong things. And I see that, and that's why I tend not to take on any sort of patient below the age of 18 whose family is not completely on board.
Right. Yeah. I completely agree. I think that family approach is important. And we get questions a lot. Can children take medication? And the answer is likely yes. It will depend on factors, and that's something that we would individually decide together with you and your child and us, and what would make sense. So the potential is there, but the lifestyle approach is going to be the most important, and then the medications or supplements is going to be a nice complement if it makes sense in that scenario.
So Barbara, I'm glad you and your daughter are watching. I saw Barbara, I think last Thursday in the office with the daughter. They're both losing a lot of weight, and her daughter's grown though. She's not under the age of 18, and they're both doing really, really good.
She's asking us a question.
Yeah. Okay.
About diet sodas. Do you suggest diet sodas or no soda period? I need a great tasting, low or no calorie drink that actually does taste good. This is a toughie.
So the way that I kind of approach this is, look, water is always the best, right? Okay, and filtered water is really even the best. But I realize everyone's not going to do that. I would say the worst would be sugar sweetened beverages.
Absolutely.
Right. So if it's a real soda, that's got some form of sugar in there, that's over there at the other end of the spectrum, opposite the water. Okay. So if you're going to drink something, I would much rather you have a diet soda than a real soda. Okay. Is it the most healthy thing? Probably not. Is it going to cause you to gain weight? No. Okay. So I don't, I'm asking you to make a lot of changes. So I'm not a real diet Nazi about the diet soda thing. So, if you feel like you need to have something like that and that kind of satisfies certain desires and you're able to go on without making mistakes drink wise, go for it. Right. And if you want to use some of those other Crystal Light.
Yeah,
Crystal Light. Yes. Mm-hmm. So, those sorts of things that you add to water that don't have sugar in them, same kind of concept. I'm fine with them. It's better to drink plain water, but I realize that's maybe asking a bit much. So
I say the same thing. I usually talk about tiers, right? The top tiers we want to really avoid at all costs. That's regular soda, that's juice, that's sports drinks with sugar, that's any kind of energy drink with sugar, that's a bunch of coffee in your Starbucks drink, or sugar in like a coffee Starbucks drink or tea. So that sweet tea, lemonade, those are all pretty much avoid at all costs. The next tier are those artificial sweetened things like the diet teas, the diet sodas. They're a much better option than the top tier, but they're not as good of an option as the next tier, which is water, sparkling water, and infused water, and then herbal teas. So there are some things out there that will give you the bubbly, like LaCroix, for instance, or the actual brand bubbly, which I think is made by Coca-Cola.
Correct.
So it gives you that feeling of effervescence on your tongue, and they are hinted with flavors of fruit. Yeah. So if you like the bubbly, but want to give up the soda, I would try a sparkling water. And then if you want to try infusing your water, it's not bubbly, but cucumber and lemon, lime squeezed in water can be really refreshing, really delicious. And then herbal teas, I think a lot of people forget about how delicious those can be. There's like, just peach flavored tea, no sweetener.
They're really good.
Really good raspberry tea. I mean, you can get green tea is actually good for weight loss too. So you can get some really good stuff out there that saves you the calories, saves you the sugar.
So look, Barbara, that's a good question.
Yeah, thank you.
For everybody who's out there, thanks for watching our show today. I don't get paid anything by the Coca-Cola Corporation. Just letting you know, I don't have an endorsement contract of any kind. Right, I'm not a brand ambassador for anybody's drink. But the diet monsters. I've talked about this in other formats before. Diet monsters, I like them, okay, because they really don't have nearly as much stimulant or caffeine as people think that they do. I think back when Monster, before Coca-Cola owned them years ago, I'm talking about like over 20 years ago, I think, or in that time frame roughly, they did have a lot of stimulant, but then when Coke bought them, they were less, in my opinion, made it a lot safer. So it's got about a can of that stuff has about the same amount of caffeine as a cup of coffee, maybe a little less. And it's sweetened with erythritol, just a couple grams of erythritol, which is the kind of sugar alcohol that we recommend to patients. As being kind of the better one.
There's a brand called Swerve that we talked about when Courtney and I did our episode that you can go back and watch on low carb products. We talked about that Swerve and we showed it, and it really is great for baking. It doesn't raise your blood sugar, and it tastes good. Doesn't have an aftertaste like stevia. So they did a good thing with that energy drink.
So that's they taste a lot better to me, and I like them better than I'd ever liked diet sodas. They don't have a diet taste to me. They're not overly sweet. It's just like 2 grams of erythritol in the whole can, and then it's got some B vitamins and herbs and stuff in there. So that's kind of one that I will drink once or twice a week. And if it's something where you enjoy the caffeine stimulation of the diet soda, and you're looking for something to replace that, maybe that's an option. Yeah. They cost a little more. That's, I forget, $2, $2.50, something like that. If you buy them at the big stores like Sam's or Costco, you can get them by the case, and they're $1.50 each, more or less. And
when it's a special treat, right? It's just there to break up the routine of drinking a lot of water. Hopefully that's not going to be a big deal. If you're going through a case a day, it's going to add up, and that's not a good thing. But as a treat, I think a lot of these flavored options, including that, is going to be helpful. Hopefully, Barbie. So hopefully, find one that you like. Hopefully, someone else got something out of that. So thank you for that. So let's move on to our next question.
Jessica from Raleigh. Are there preventative ways to avoid loose skin after major weight loss? I guess it depends on what you mean by major.
Right, and it may depend on your age. So there's a lot of factors, your gender. But I think Jessica's probably asking for herself as a woman.
Mm-hmm.
We'll see a lot of our patients will answer it kind of as our older women who maybe are in the perimenopausal or menopausal state, because a lot of those women are part of our practice and struggle with their weight. So maybe that would be a good way to approach the question is women who have lost a lot of weight and are not in their teens or 20s.
Yeah, I would say that, look, I am surprised by, once you've lost a fair amount of weight, some people think, well, my skin is loose enough and so forth, that this is going to be a problem. And I always say, give it 6 months of a good effort at weight maintenance, okay? And exercise is part of that. Regular exercise is part of that before you make a decision on how it's going to look. You'd be surprised how good it looks after 6 months of maintaining your weight that includes regular exercise. It might be nearly as bad as what you thought. And so once you reach that point, then you have a decision to make if it really bothers you. If it's a lot of excess skin, then surgery is really the only thing that's going to help, and a plastic surgeon would have to be involved there. Now, if it's not an excessive amount, there are non-surgical treatments, and we're going to be getting into this as part of our line of services very soon, and we'll be sending out some announcement emails and so forth about it. But there's very good technology to tighten that skin and further reduce subcutaneous fat. It's non-surgical, it's painless, and it's very effective. And so the machines that we got are made by a company called InMode, and InMode is a big player in this arena, and they've got some really great technology out there. It works fantastic. I have a before and after of someone who's had 3 of the InMode treatments on my phone, and maybe see if I can bring that up on front of the screen. Well, I don't know how well this is going to work. The patient's face is not in the photo, but so this person had 3 treatments on some loose skin on her abdomen, and the abdomen. Before I put it up to the screen, I'm giving you the preface, okay? So the abdomen has some loose skin on it, and the patient needed the skin tightened. Now, it normally takes 4 treatments, 2 weeks apart, and then the full effect is not seen for 6 months. I took these pictures after 3 treatments. It's a total of 5 weeks, and at the 5-week mark, roughly. And so this doesn't represent the full result, but the result is already pretty dramatic. And you can see, I think, the one, if you look closely, you can see the one picture has a lot of excess skin, and then the picture 5 weeks later is, I think you can see the skin is much tighter. And that sort of thing can be accomplished without having to go see a surgeon for a lot less money.
And without pain.
That's right, and without pain. And it takes about an hour of treatment, usually for something like the abdomen like that. An hour every other week for 4 weeks. And we'll have lots of announcements about when we're rolling that out. We have machines already. We've been doing some cases, but we have some practical concerns like space and so forth that we're addressing now before we roll it out. So anyway, I think a lot of you will like that sort of thing, and it works really nice in someone who's lost weight. Again, if there's a lot of skin, though, sometimes you just have to bite the bullet and go see a plastic surgeon. I want to make sure in my mind, though, and I think that the plastic surgeon would all tell you this. I mean, you want to be of a mindset where you're convinced that you're in it for the long haul, diet and exercise wise, because once they take that skin off, if you regain that weight, this is a problem. It's a real problem. And so before you make a big decision about that, I would really take a lot of time to give yourself time to prove that you can maintain that weight loss, right?
Exactly. Yeah. And I'll just add, there are definitely, there's a lot of variability with skin and how people feel about it. I think some folks can get to a place where they don't look the same as they did before they lost the weight, right? That it's kind of like many women don't look the same after pregnancy, but having gone through that journey, they can come to be a little bit more comfortable with certain changes that have happened. And sometimes we will counsel on more of a body acceptance, and you've done such a good job and we'll do everything we can to try to make it better, but it may not be what your expectation is. So then we try to lower that expectation to a place where, it's kind of a sign of how wonderful you've done and how much weight you've lost and all the other benefits that you've achieved. But having said that, there are still options out there, like the surgical option, which I will say a lot of our patients have gone through. There is nothing wrong with doing that.
Absolutely.
I know there can be a lot of stigma in weight loss and with cosmetic surgical options, but it is your decision. It is absolutely your decision. So if you choose to do that, I think that's absolutely fine. If you choose to do something like we will have available in the future, this in-mode ability to tighten the skin and reduce that sub-Q fat, that's great too. I just want to really reiterate that 6 months of weight maintenance with continued healthy lifestyle and exercise is very, very important. Sometimes when we lose weight, we will lose muscle mass, and we need to kind of rebuild muscle mass to fill in a little bit of that area that's sort of deflated and has gotten much more soft. So sometimes building muscle will help. There is a supplement I recommend a lot. It's collagen, which is a type of protein. And we're constantly talking about how important it is to include protein because our skin is made of protein. Our bones are made of protein, our hair, our nails, everything. Our heart is a muscle, right? So we really need to be good about eating enough protein. And collagen is a powder that you can get that's tasteless and odorless. They do have it in capsule form and gummy form. I always say, get the powder. It's going to be the most affordable. You can put it in water. You can put it in coffee. You can put it in yogurt, whatever. It's very easy to get in. And that collagen is a certain type of amino acid structures that will actually help with skin tightening and with just keeping your skin as healthy as possible. So that's something to do in addition to all these other things if you wanted another really natural option, Jessica, or anyone else who struggles with this.
Totally agree.
All right, moving on to Mary from Raleigh. What low calorie frozen meals do you recommend, or should they be avoided altogether? This is a good question. We have a lot of folks who grew up in the era of lean cuisines and healthy choices, and it's kind of hard to navigate because now there are ones that are specifically low carb, such as Atkins, or maybe the healthy choice has a low carb and a low calorie, but maybe not a low carb and a low calorie. So it's hard to figure this out. There are some good options out there that may not be super, super low in calorie, but will be carb controlled and will be what we're mostly encouraging, which is protein and vegetables, right? So you really want to pick ones that don't have things like pasta and rice and potatoes in them. Those are really just cheap fillers that aren't going to help you feel full. They're going to make your blood sugar go up really high, and it's going to be hard to lose weight eating those things. But the Atkins ones are good. There are some low carb versions that I think both lean cuisine and healthy choice. And then there are companies that will make meals for you, which I'm a bigger fan of, such as Clean Eats in the Triangle area, ends with a Z. Eats ends with a Z. That's really great. And they have many, many others that will deliver you food. So if you can't find something in the grocery store, go to our resources section on our website, simonsmetabolics.com, and scroll down to where it talks about meal delivery companies. And you will see a lot of great options where you can get meals ready-made or recipes to make your own healthy, low calorie or low carb or vegetarian. They all have all the options, I find.
Yeah. Every now and again, I'll get somebody. I've got a patient like this now. She's been very successful on what I call a lean cuisine diet. So when I put her on a low carb diet, she gained weight, and she was very, very meticulous about what she ate. And this person just has a really, really low metabolic rate and didn't respond to a low carb diet like I thought. This is generally the exception and not the rule. And but she said the only way I've ever been able to lose weight was eating lean cuisine or healthy choice meals, and 2 to 3 of them a day. And I said, okay, let's go back and try that. Well, she's gone on to lose 30 pounds. So, there might be a scenario where those sorts of things work. I mean, I always say starvation still works. I mean, you think that's what calorie reduction is. It's a form of starvation. And I guarantee if you go to a famine-ridden country, you will not die overweight. You'll die thin. And so so to that extent, lean cuisine meals, they'll work if you're eating 2 or 3 of them a day, and that's all you're eating.
Right.
You'll lose weight.
Yeah, if that's all you're eating. So if you're really using them as a meal replacement, not as a snack.
That's right.
Right.
So 600-700 calories a day will make you lose weight.
Yes.
So anyway, okay. Thanks for watching. This is the Dr. Simon's Metabolics and Weight Loss Facebook Live event.
Getting through our questions.
That's right, Sarah. Sarah from Morrisville. My doctor told me I'm deficient in vitamin D. Will improving this help in weight loss? Michelle, what do you think about that?
Well, I think vitamin D has a lot of wonderful, wonderful purposes. And I think we all need to be taking vitamin D because safe to say, Sarah, you are in the majority for sure of vitamin D deficiency. Many of us are low in vitamin D. And while I do not advocate the use of vitamin D for weight loss, I do believe that vitamin D plays a vital role in things that also involve our health, right? Our cardiac health, so our heart health, our blood pressure, our immune system. Vitamin D is extremely important for. Vitamin D also keeps our bones strong, so keeps us from, getting fractures, as we get older. So is vitamin D super important for health? Yes. Is taking vitamin D going to help you to lose a lot more weight? I don't believe so. But if you're doing all the other healthy things along with taking vitamin D, then chances are you will achieve healthy weight loss, and hopefully we can help you with that. If you need something other than supplements, we have prescription medications that help a lot and are used for the purpose of weight loss.
Look, vitamin D for a lot of reasons right now is a very good idea. Look, with this COVID thing, I'm telling you, vitamin D plays a very big role in outcomes if you were to get it. So there's a lot of data that suggests that if your level, when you check it at the lab, is over 50,000, your outcome is going to be way, way better. And so if you were to do an internet search about this now, you would get a lot of hits about the benefits of vitamin D in terms of prevention of the COVID or in terms of how do you get a better outcome if you get COVID. And I totally believe this stuff, like a lot of things. There's not time to run a giant study during the middle of the pandemic, right? But the associations between a higher vitamin D level and a better outcome are very strong. And I'm a big believer in it. So anyway, I think now is a good time to be taking it.
Yes, and we do carry it in the office. In both offices, we have it through a company called Metagenics, which has super high quality products. And generally, folks need, I say, between 2,500 and 5,000. Pretty much safe to say most of us could take 5,000 a day easily and never risk deficiency. Vitamin D is one of the few vitamins that you can take too much, but I'm telling you, it would take a lot, way too much, more than anyone would be taking to worry about that. So I would not worry about a toxicity from vitamin D if you're just taking 5,000 units a day, which is correct. Which is easy to get in a tiny little gel cap.
All right, Todd from Durham. My wife is pressuring me to lose weight and to work out more because diabetes runs in my family. Can I assume the diabetes really be avoided? My answer to that is type 2 diabetes is primarily a disease of fork to mouth, and so I do believe that, although not 100%, but generally as a rule, if your diet is right, you can avoid type 2 diabetes.
I agree. And it can be reversed as well. A lot of people don't believe that, but we do it all the time in our practice.
That is exactly correct. It is a disease of carbohydrate intolerance. That's what type 2 diabetes is. It's a disease of carbohydrate intolerance. Your body was not made to eat an excessive amount of carbohydrate, which raises your blood sugar. And if you're going to pour on the carbohydrates in your diet year after year after year after year, eventually you're going to end up with a blood sugar problem, and we call that type 2 diabetes. The answer is let's get those carbohydrates out of your diet. Okay, our ancestors didn't eat all of that. Your body's not adapted to that. So you eat animals, what comes from animals, and what you grow in a garden. That's the cure, essentially.
And I know Todd also mentioned lose weight and work out more. And I think
Yes.
these both are very important when
Yeah.
we're talking about prevention or reversal of a chronic disease like diabetes. So
if you're regularly exercising, that's really going to improve your regulation of insulin and glucose at the cell level. And so it has real benefits, Todd. Yes. So restricting that carbohydrate intake in your diet and getting regular exercise, irregardless of the weight, is going to really help you in terms of prevention.
Absolutely. And weight is not the only factor that affects. We have a lot of thin individuals in this country who have diabetes, and a lot of individuals who have extra weight who do not. So it's not a guarantee, but if you have a genetic predisposition, family history, it's good to be on top of it because your risk is higher. So thanks for that question, Todd.
Okay, Eric from Raleigh. I feel like I'm more focused when I'm taking Phentermine. Is that real or is it in my head?
That's real.
It's real.
Yeah.
Yes, it is real. Most people do experience a sensation of being more focused while they're taking Phentermine, and this is good. I've always maintained that there's some degree of attention deficit disorder that leads to weight gain because you don't realize how much you're consuming, what it is, that sort of thing. You're not as focused as you should be on it. And it's amazing that although this wasn't the primary intent of the Phentermine when it was approved by the FDA in 1959, I can tell you that people who take it say they're more focused. And as they get more focused, they're a lot more careful about what they eat. So this is a good thing. I think.
I call it a side benefit. So Phentermine is an appetite suppressant that's been around for 62 years, and it's widely used to help treat weight. And we use it in our practice. Many other practices like us use it. And I kind of refer to it as a cousin of the medications that treat ADD and ADHD. So they're sort of similar. So folks say that they get benefits with Phentermine, such as in, greater motivation, increased energy, improved focus. They're more productive at work. They're more productive at home. They're more productive in their healthy eating plan, right? They make a plan and they can stick with it. And that's a really important part of how Phentermine works. In addition, it also raises metabolic rate. It helps you really see results so that you're able to stay focused and keep going with your plan. So it is definitely not in your head. That is a really remarkable benefit of Phentermine.
Yeah, you can get more information on that at simonsmetabolics.com. I will also just add, because I inevitably get asked this, there is a distinction I'd like to make, though, that the medicines that we classically use for ADD and ADHD are true amphetamines.
Yes.
And so when you look at their generic names, it says, for example, amphetamine salt. Now, the Phentermine is the chemical name for. We're just using that because it is generic, and so it is not amphetamine. It's much more in its chemical structure, more similar to, say, a decongestant. And if you look very closely at the medical literature and a thorough evaluation of the medical literature over the last 60 years, you'll see there's never been a reported case of substance abuse or addiction with Phentermine. Okay, there is with amphetamine. So I want to stress that because I get asked about it. Hey, am I taking an amphetamine? I'm going to come up positive on a drug screen. Am I going to get addicted to this? And my answer is no. I really don't think you are going to get addicted to it. You'd be the first case in widespread use in 61 years or 62 years now. So although it has a stimulant character, I don't consider it to be an addictive substance.
Right. I totally agree. I'm glad you stressed that point. And with the urine drug screen, it can sometimes show up, not because it is an amphetamine, but because the chemical structure is similar. Again, kind of that cousin relationship. Kind of like if you have a poppy seed bagel and then it looks like you had opium.
That's correct.
You didn't, right? It was just a bagel. So sometimes that can happen, and we can furnish a letter if we are prescribing the Phentermine to you. It's not an issue, but it is a safe medication that helps with a lot of things. And if you feel like you need help, give us a call. We're here. We're open. Raleigh, Durham. We can do phone visits. We have a pharmacy on site to make it easy. So we're really here to help make this process as simple as possible for you to get healthy and feel your best.
Okay. Well, I think that's it.
Yeah.
We want to thank you for watching the Dr. Simonds Metabolics and Weight Loss Ask Me Anything Facebook Live event. Please visit us on our website at simonsmetabolics.com. Come by and see us. Both offices are open this week. Thanks for joining us, and we'll see you again in 2 weeks.